Hello everyone and welcome to this new video on FNAC or Fine Needle Aspiration Cytology. Now through this video I will explain all the process, all the important points that people tend to miss out so that you can perform a successful FNAC. I will also show you video demonstration. So this video will be interesting. So let's get started with this video. Now, before I jump onto FNAC, I would like to tell you a bit about it. So, why do we do FNAC? Obviously, because it is one of the most simplest procedure, simplest test that we can do on a patient without giving much pain to the patient, right? And it is very useful. It do give us a lot of insight into the diagnosis, the at least the pathway that in which direction is going. It's going in the malignant direction or benign direction, or what it is sometimes it gives so important informations that you don't even need to do a biopsy, राइट सो FNAC लगता है बहुत छोटी सी टेस्ट है लेकिन इसका इम्प्लीकेशन बहुत ही ज़्यादा है और साइटोलॉजी लगता है बहुत ईजी है लेकिन ईजी है नहीं ठीक है दे आर लॉट ऑफ इंट्रिगिंग थिंग्स बिकॉज जितना छोटा उतना ही ये धमाका है ठीक है तो छोटा पैकेट बड़ा धमाका है तो दिस वीडियो विल बी रिगार्डिंग द प्रोसेस द प्रोसीडियर हाउ टू डू एन FNAC so that you become a master in that but I have a request that this video is only for educational purpose okay and don't misuse this and even if you see the video you will get a complete idea आप खुद ही perform कर पाओगे but still I would request you to do it under the supervision of your seniors and if you still don't have a proper degree. Now what I would like to tell you before I start with the FNAC is that what is cytology, a little bit about cytology. That means FNAC is a part of cytology, right? So what is basically the entire spectrum of cytology? So you have something called as the exfoliative cytology. Now ये क्या होता है? The cells in the body, they are shed into the body cavity or the body fluid which is collected and then it is tested. That is a different kind of cytology. We are not doing any procedure there. It is an exfoliative cytology. So what is that? This is basically what we do as fluid processing. हम लोग सेंट्रल लैब में ये करते हैं राइट तो दैट इज एक्सफोलिएटिव साइटोलॉजी देन वी हैव समथिंग कॉल्ड एज द इम्प्रिंट साइटोलॉजी whenever any biopsy or let's say true cut biopsy or core biopsy is taken it is touched on a glass slide and then the cells are imprinted on that slide. We just take a slide, if this is the slide and if that's the biopsy material, we just touch it and we roll it like this, then the slide is getting the imprint of this biopsy, right? So this is basically the imprint cytology. But there is another spectrum which is the FNAC, right? So I guess now you know the basic headlines of cytology, right? Now please understand that any kind of pap smear that we do, that is also coming under exfoliative cytology because here the cells are scraped. We are not puncturing, we are not doing a needle aspiration, right? This is cytology, right? Now obviously what are the lines along which we give the diagnosis is we will give it either it's benign or suspicious for malignancy or it's malignant so that the doctor or the clinician at the first go can have an impression कि किस तरफ ये point कर रहा है और क्या extra investigations करना है क्या confirmatory investigations करना है ठीक है so it's a very important and a very useful guiding tool. Obviously we can't confirm ठीक है क्योंकि यहाँ पे कैप्सुलर इन्वेजन हमको दिखता नहीं है हिस्टोलॉजी इज कन्फर्मेटरी FNAC इज नॉट कन्फर्मेटरी वी कैन नॉट कन्फर्म कि हाँ ये हाइड्रेडनुमा है वी कैन कन्फर्म कि हाँ ये तुम्हारा लेट्स से एनी पर्टिकुलर मैलिग्नेंसी पे हम इसको मतलब वी कैन पुट अ स्टैम्प ऑन द डायग्नोसिस लेकिन इसीलिए इसका रिपोर्टिंग का फॉर्मेट भी बहुत अलग है. यू हैव सिस्टम्स, यू हैव बेथेस्डा सिस्टम्स, यू हैव फॉर सर्विकल साइटोलॉजी, फॉर थायराइड साइटोलॉजी. तो आपके पास में क्लासिफिकेशंस होता है. यू हैव रिपोर्टिंग डिफरेंट रिपोर्टिंग फॉर्मेट्स जिसमें आपका ऑप्शंस क्या होता है. यू हैव बिनाइन, यू हैव अनसैटिस्फैक्टरी, यू हैव एटिपिया ऑफ सिग्निफिकेंस, यू हैव सस्पिशियस ऑफ malignancy. So you can only write this. Although you have got entities inside this, I guess you're not able to understand much because if you are not a pathology resident, then you probably will not understand what I'm saying. But I'm saying is that you are not writing a full-fledged diagnosis as you write in histology over here. You're reporting this according to the reporting as it is done for an FNAC report. ठीक है. सो FNAC का रिपोर्टिंग बहुत ही अलग है, साइटोलॉजी का रिपोर्ट बहुत ही अलग होता है ठीक है, उसका अलग फॉर्मेट होता है. वो चैप्टर वाइज जब होगा लेक्चर तब आप लोग को समझ में आ जाएगा ठीक है. So now let's come to the main part which is the FNAC or the fine needle aspiration cytology. Cytology means cells obviously. Now please understand there are two kinds of procedures basically what we do here. Okay, so let's dive into the procedure now. So one you have, which is the guided procedure, which is the the USG guided or the CT guided FNAC. This is not something which pathologists all the time they don't do it. The radiologists and all, they also sometimes do it. It is done by various departments altogether, but examination is done by us. So the examination we do it, right? So this is the guided procedure. Now why it is done? It is done to mainly, I'm not saying all the time, mainly it is done to detect the metastasis. Okay, primary तो obviously होता है, लेकिन mainly whenever a slide comes to you, whenever a guided FNAC slide comes to you, you must understand, you must take proper history of the patient, क्योंकि उसको तो आपने खुद नहीं किया है, वो करके आया है, वो आपके पास में स्लाइड लाया है, तो उसका आपको बहुत अच्छे से उसका हिस्ट्री आपको लेना चाहिए, because you must take the history of a malignancy happening anywhere in the body. That means the FNAC is done to suspect metastasis from that malignancy in the organ that you are doing. Okay. On the other hand, if you talk about blind procedure, this is something which is done by a pathologist day in and day out. ठीक है. So any lump or swelling in the body, obviously not on the internal organs, especially on the external part of the body, we do FNAC, okay? And of course, if you talk about TB, now please understand, most of the times we get a granuloma, we stamp it to be a tuberculous lymphadenitis or whatever, or a granulomatous lymphadenitis, right? But TB हम लोग ना confirm नहीं कर सकते. Granuloma is seen in a lot of other conditions. So TB is not something that you can confirmly say. Yes, you can say probably of tubercular origin. This is how you write the report. That can happen, but you can't diagnose it completely. Why? Because it is confirmed on CBNAT or AFP. It is not confirmed on FNAC. TB is not confirmed on FNAC, right? So I just want to clarify this. मुझे लगता है कि क्या काफी सारे स्टूडेंट्स को ये डाउट होता है, ठीक है? So now we'll come to the proper process. So before I show you the process, I want to discuss a little bit about this before I jump into that video. So obviously before you start, don't jump into doing the needle aspiration. You have to properly take the history. हर चीज में हिस्ट्री बहुत इंपॉर्टेंट है. पैथोलॉजी में हिस्ट्री का बिना, क्लिनिकल एग्जामिनेशन के बिना, it doesn't fit into place. It's just a 2 + 2 = 4. You have to correlate the history with the findings and then come to a diagnosis. You can never just diagnose it. You're not diagnosing a slide. You are diagnosing a patient. So have that acumen. Know about the extra things as well. Just don't consider yourself to be a pathologist and you're not reading anything from the clinicals. You have to have that acumen as well. Okay. So any smoking ka history, any increase in size, fever, weight loss, anything, it differs from case to case, but you have to take a proper history, examine the patient, ask anything you want, just as you used to take the history. Just make sure that you're understanding the profile of the patient before you jump into the aspiration. Now, yes, you have to take informed consent. Sometimes you do take that. Submit the document that is required. Now we'll start with the procedure, okay? So make the patient lie down. Supine position is the usually preferred position. So skin preparation is done using an antiseptic, and then you have to explain the procedure. Please understand. Please talk to the patient, explain the procedure, take consent, make the patient comfortable. Okay, so these are the important things that when you practice, if you have this kind of approach, you will be a better practicing pathologist. Okay, so so if you're doing a thyroid, then you have to place a pillow below the shoulder region, so that you have to ensure hyperextension of the neck and adequate exposure. Because of that, you have to put the pillow below the patient's shoulder. So these are the positions. So you have to properly position the patient, make sure you have a proper access to that. Any kind of procedure that we do, you have to fix the lump or whatever, the region, with your fingers. Your left hand is for that, is for fixation. And with the right hand, you will do the procedure. क्योंकि ये तो आप सुपरफिशियली कर रहे हो ना, ये ब्लाइंड प्रोसीडियर है. तो देखो, लंप इतना बड़ा भी नहीं होता है, बहुत छोटू सा होता है लंप. तो अगर आप उसको अच्छे से फिक्स नहीं करोगे तो वो स्लिप कर जाएगा. वैसे भी जब नीडल अंदर घुस रहा है, आपको पता भी नहीं है नीडल कहाँ पे जा रहा है. तो यू हैव टू मेक श्योर इट इज हिटिंग योर टारगेट. आपको वहीं से मटेरियल चाहिए ना, तो फॉर दैट यू हैव टू फिक्स इट. जिस तरह से आप लंप को फील करके, एक पैल्पेशन करके आप डिफाइन कर चुके हो कि हाँ इस जगह से मुझे लेना है, तो उसको आप अच्छे से 2 फिंगर या 3 फिंगर, जैसे भी आप कंफर्टेबल हो, उसको फिक्स करो पहले. उसके बाद यू वांट टू स्टार्ट विद द प्रोसीजर. इंसर्ट द नीडल विद द राइट हैंड. नाउ yes, so we have a gun, which is what is the name of the gun? It's the Franzel's handle, right? So I guess I have yes, so this is the gun. Okay, this is the gun. I'll show the video, but first let me explain this procedure. So you have the gun in which you put this needle like this. Okay, So what you have to do is that you have to properly put the syringe in the gun and make things ready before you start the procedure. Now you're going to insert the needle. So insert the needle, the syringe attached to the gun. So now you have to give the suction. So once you enter your gun, your needle inside the lump, then you have to pull the handle, and that is the suction that you're giving. And once you're giving the suction, you have to kind of do excursions of the needle to and fro motion as fast as possible at different angles. Just remember these points. I'm going to show you the video, but you have to do the excursions very fast at different angles, okay, in the to and fro motion. What is the syringe that we usually use? We usually use a 10 ml syringe, but the needle is usually 5 ml, and sometimes if the swelling is huge, you can also use a 10 ml syringe. 23 to 27 gauge needle. If you have thyroid, then please do not use gun. Avoid using your gun if you're doing a thyroid procedure, because you have vital structures over there. So avoid using that. You can do it just with a syringe, or even just with a needle as well. Okay, so that is what I'm saying you, that you have to do the needling procedure, जिसको हम बोलते हैं इस तरह से टू एंड फ्रो मोशन करके आपको needling करना है हर एंगल में, until you will see that the material is seen in the hub of the needle. तो सक्शन आपको देते रहना है, उस हिसाब से आप प्रेशर को देख लो कितना सक्शन आप देना चाहते हो, ठीक है. So this is plus minus suction. Just give it and do a to and fro motion until you have the material at the hub. And then what you are going to do is this suction will cause dislodging of the cellular material and easy suction into the needle. Now once you are doing this for a period of 5 to 10 seconds, the suction is maintained, and as soon as the fluid appears in the hub, the suction is released. A very very important point is that a suction is released. You have to release the suction. Please leave the suction interiorly and then only pull out the needle. Okay, so release the suction, place the material on the slide and make a smear. Don't push it, don't pressurize it, don't force it. Just lightly make the smear, because if you're giving a lot of pressure, the cells will break. So after you are done, you have to dry the smear and do a proper staining. लिशमैन जिम्सा stain जो आप लोग करना चाहते हो कर सकते हो. कई बार क्या होता है कि फ्लूइड आता है, समटाइम्स यू गेट अ सिस्ट फ्लूइड. उस टाइम पे आपको वो एक जैसे बाल में लेना है, उसको सेंट्रीफ्यूज करना है, उसका जो हमारा सेडिमेंट है उससे आपको सेल ब्लॉक भी आप कर सकते हो. So that is what you can do it. Okay, now before I come to the advantage and disadvantages and all these points, I would like you to see the video first. Okay, then you will be getting a complete idea. Yes, so please see this. So we are putting this needle in the Frenzel gun. Okay, and after you are done with this is ready. Now you're going to open this needle and we are going to hold it like this. Okay, hold it like this and hold the lump with the other hand, and you can see that the suction is being released inside. Now there is no suction releasing because it is not inside an organ, but once it is done, it is usually being like that. Then you have to open the syringe and take ear, and then place it on a smear, and then you have to also sometimes do like this, and this is how you make the smear. So I guess you're able to understand this, and then after that you do the numbering of the this thing. Okay, so see how by different angles they are doing the procedure, right? Different angles go, then pull the syringe and you have entered the air inside the syringe, then you have to push it, and the material will be there on the syringe. So I hope that, please see this video once again. Okay, I guess this is very simple. You have to do the excursions inside. See how I'm pulling the suction, doing the excursions, leaving the suction, very important. Okay, leaving the suction is very very important. Leave it inside the organ, and then you take out the syringe and fill some air and push the material in the slide. Again, push it multiple times. Then you can also do like this to to get the remaining of the whatever cells you have, and then you make the smear. ठीक है, बहुत अच्छे से एक स्लाइडिंग मोशन में आपको स्मीयर प्रिपेयर करना है, बस नंबर लिखना है. ठीक है, हर एक एंगल से उसको आपको लेते जाना है. ठीक है, फिर सेम प्रोसीडियर. ओके, जस्ट fill some air and push the material on the slide and That's it. So a very easy and pretty simple procedure. Now some extra points. Yes, advantages, very simple, painless, fast. Disadvantage is that you cannot differentiate between the capsular and vascular invasion. You cannot differentiate between the in situ and the invasive carcinoma. Cell block mein, yes, IHC study can be done. That is why cell block is a better option. Whenever you have the opportunity to do that, please make a cell block. Now, yes, we have to write on examination whatever the measurement of the swelling we have got, that we have to write. Aspiration में आपको क्या क्या मिला है वो that you have to write, like blood mixed or pus or clear, whatever it is. और breast lesion में you have to avoid piercing the NSC because that can be very painful. So I have mentioned all the possible points here. Okay, so that is it regarding this video. Now I would like to tell you regarding a very important point, and that is, please look at this. Okay, see this. Now, see, FNAC can be done without aspiration as well. With aspiration and without aspiration. So, मतलब क्या होता है? Aspiration, I guess, is a wrong term. With suction or without suction, ऐसा होना चाहिए. तो with aspiration का मतलब है आप इस चीज को सिरिंज से कर रहे हो, सक्शन दे रहे हो, जो नॉर्मल प्रोसीजर हम लोग करते हैं, जो वीडियो हमने दिखाया है, दैट इज विद एस्पिरेशन, मीन्स विद द सक्शन यू आर डूइंग इट. आर यू एबल टू सी दिस इमेज? ठीक है, तो मैंने जो दिखाया है वो है विद एस्पिरेशन, बट इट कैन ऑल्सो बी हैपनिंग विदाउट एस्पिरेशन. मतलब यहाँ पर ना ही आपका कोई सक्शन है, ना ही आपका कोई सिरिंज है. आप देख सकते हो यहाँ पर कोई सक्शन नहीं है, कोई सिरिंज नहीं है. You just have the needle. You are just doing the to and fro motion, the excursions of the needle without a suction. And once you have the material, then you put the syringe, take the air and push the material on the smear. ठीक है, तो this is what I was talking about. This is what we usually do in cases of what? Thyroid. राइट, जहाँ पे हम लोग सक्शन अप्लाई नहीं करना चाहते हैं, रिस्क होता है, देयर वी डू लाइक दिस विदाउट एस्पिरेशन. ठीक है, तो एक सवाल है कि मान लो कि when what are the possibilities that you will not get an adequate sample? You have missed the target. Most common is that you have missed the target because it's a blind procedure. आपको अच्छे से palpate करना है, इसलिए मैं बोल रही हूँ. Palpation is the most important thing to kind of get rid of this problem, right? And it may also be fibrotic, desmoplastic. तो वो फिर आपका कोई कसूर नहीं है उसमें. ठीक है, ये होता है, ये a lot of the samples get reported as blood only smear, not adequate. So that is very common, nothing to worry about that, right? Now another very important question which is asked, and a very important concept which you must know, is that whenever you are doing FNAC in a malignant lesion, understand that if you are doing an FNAC in a malignant lesion, once you do the FNAC, you are creating a tract, right? You are creating a tract once you are doing the FNAC, and now in this tract you are taking out the malignant cells and you're putting it on a smear and we are doing the examination. That's fine, but these cells, these malignant cells, can get adhered in that process of the tract, right? And from these cells there can be secondary carcinoma formation as well, right? So the surgeon has to cut out this tract as well while he will be performing the surgery, else the tumor cells may remain in the passage of the tract and can grow back slowly, right? So it's very important that that the surgeon has to take care of. And please understand that on the resected specimen, now this specimen, one मान लो कि वो जो थायराइड का ही मान लो कि एक स्पेसिमेन आया है, एक सैंपल जो कि आया है, मतलब एक पेशेंट आया है बेसिकली. सो वंस यू आर डूइंग द FNAC, दैट हैज कम आउट टू बी malignant, and now this patient had undergone hemithyroidectomy, and once you've got this specimen, you will be able to see this tract, क्योंकि आपने खुद बनाया था, है ना? तो वो ट्रैक्ट आपको दिखेगा, वो माइक्रोस्कोपी में वो ट्रैक्ट आपको दिखेगा. मतलब वो आपको समझ में आना चाहिए कि मतलब यहाँ पे FNAC हुआ था पहले. समझ रहे हो? तो यही है थोड़ा बहुत एक्स्ट्रा पॉइंट्स जो मैं बताने की कोशिश कर रही हूँ. आई गेस आई हैव काइंड ऑफ mentioned all the important points. The procedure is quite easy but quite tricky as well. Sometimes material do not come, but then we have to keep trying. We do repeats as well. ठीक है, ऐसा नहीं है कि एक ही बार में आ जाता है. We also do repeats. तो ये चलता रहता है, इसमें इतना टेंशन की कोई बात नहीं है. ठीक है, सो आई होप यू अंडरस्टूड दिस वीडियो and like this video. So I'll take you leave today and meet you very soon in my next video. Till then, Take care, keep smiling, and thank you for watching.